Hello and welcome to the Community Connect podcast brought to you by Healing Hands Healthcare. I'm your host, Fernando Garcia, and I'm joined with a couple of my friends today. On the audio and visual, we have Matt Ledesma, our Public Relations Coordinator, and today I'm joined with Jessica Weatherly, one of our RNs, and we have the privilege to be joined with us with Jackie Hamm, CEO of The Kitchen. How are you doing today, Jackie?
Great. Thank you for having me.
Oh, I'm so glad you're being here. So everyone have a nice weekend, got out, enjoyed some of this beautiful weather some?
Yes.
Good deal. Well, Jackie, thank you for joining us. And when did you first become passionate about serving our community with The Kitchen?
Well, I was excited when I interviewed for the job, but it really hit me, I think, the first day I went out and delivered a meal. Mm-hmm. That was powerful. Very powerful. Definitely. Yeah. I would encourage everybody to just go do it at least one time.
Yes. I've delivered previously, and these people are really gracious. They're really grateful for the service that y'all provide to this community and just the social interaction they get. They're really happy to see you. I mean, aside from the food, they're really happy to have that interaction with someone other than maybe being at their home by themselves and not seeing anybody for the entire week.
Absolutely. We're just a big family.
Yes. Can you tell us about the programs The Kitchen offers? Y'all actually offer several different programs that the community might not be aware of.
We do. We have our... we have our Meals on Wheels program, which is the home delivered meal program. Mm-hmm. We also have our Red Door and Green Door congregate sites, which the Red Door is at our main office, and the Green Door is in the Martin Luther King Center.
Okay.
We serve congregate meals there. We have an Anna meal program. We deliver dog and cat food along with the hot meals. We found that we do a survey every year, and we found that some of our clients were using part of their meal to help with their dog or cat. Mm-hmm. And so, we need our clients getting that nutrition every day.
Yes, definitely.
So we started delivering dog and cat food once a week. Then we also have a weekend meal program that is 100% funded by the community, and it's about a $220,000 program a year. And all the weekend meals are funded locally.
Oh wow, that's amazing.
And we're getting ready to start our rural program. We've ordered a truck. It should be here in a couple of months. We've talked about our rural program. We're going to be able to go outside of, right now the kitchen only serves the city limits of Wichita Falls. Mm-hmm. And so we're going to go outside of the city limits of Wichita Falls and serve the entire county of Wichita, excluding the areas that are served by the Friendly Door and Burke Burnett and Electra. Okay. They have programs of their own.
Okay. And so we're just where it's lacking. Yes. We'll make up that space.
We're going to hit the area where nobody's covering.
Oh, good deal. Amazing.
Yes.
Oh, wow.
So we're excited about that. We're hoping that program will launch probably early summer, before we get our truck. We're ready. We're just waiting on the hot cold truck, which is on back order.
Yeah. Oh, awesome. Good to hear that. Well, I recently saw online that the mayor proclaimed March for Meals. Can you tell us more about that?
Sure. So the Older Americans Act was signed in March, and that provides funding for our congregate sites, some of our home delivered programs, some senior programs, some of the fun things we do at our congregate sites. This all provides a little bit of funding for all that. And so this is Older Americans Month. We celebrate it nationwide. It's a program through Meals on Wheels America. So everybody all across the United States is celebrating March for Meals right now. We are having our actual Community Champions Day on the 30th, where we have city, community, state dignitaries and people who are supporters of the kitchen will come deliver that day. And we'll also declare that this is March for Meals Month, and that day will actually be March for Meals Day.
Okay, cool.
Yeah.
Good deal. Who's been your biggest supporter, either professionally or personally, during your time with the kitchen?
That's really a hard answer because there's so many more than just one.
Yes, I'm sure.
Anytime I have a big dilemma, of course, I go to prayer. Mm-hmm. So that's my biggest supporter.
Definitely.
And outside of that, my board. We have been blessed with a wonderful board that is just so compassionate about what we do and just just gung-ho to start any new program that we see that is a need in the community.
Yeah.
So our board, and then Shirley Bradbury has been at the kitchen for 37 years.
Oh, wow.
And she has been I'll go into her office and close the door, and she talks me off the ledge. Okay?
She reels you back in.
She does. She does. So
Good,
she's
good.
been a huge support too.
Oh, good.
And then I sit on the board for Meals on Wheels Texas. So we have that networking is so fabulous. If we have an issue here, I can call my friends in Fort Worth, Austin, wherever. Okay, what do you do about this? So that networking thing is huge.
That's nice to know that you're not doing it on your own. That you have it sounds like you have a very good support system.
I do. And like I said, prayer being my number one.
Yes, definitely.
Yes.
What's one lesson your job has taught you that you think everyone should learn?
It's not always like it seems. However you see it, that you got to sometimes dig a little deeper. And the reason I know that is because it's really funny how some of our clients are really in need of the program, but it's hard to convince them of that because there's a stigma attached to it that it's for low income or it's for people who can't afford food, but that's not the case.
Okay.
It's for those people who have gone before us and those people who now are still trying to live in their home, but it's hard for them to cook a lunch. Yeah. It's hard for them to cook a meal. That's what we're here for.
Good.
Let's bring them a meal so they can live out their life in their home and stay out of that skilled nursing facility.
Yeah, definitely. Exactly.
I know whenever I'm talking to my patients about Meals on Wheels, one thing I do present is it's another face to check on you throughout the week. And it has saved lots of our patients. I mean, Meals on Wheels has found them on the floor and has been able to get them help, or they've not been able to answer the door and they've been able to call for that welfare check. So it is another face to check on them throughout the week and make sure that they are doing okay.
Yes, absolutely. That's one of the things that we do in our office is when you go out and deliver and you bring your route sheet back and it says Mrs. Smith wasn't home, well, we get on the phone and we find Mrs. Smith.
Yeah.
And before we go home that day. And so we have a great partnership with the hospitals, with the home health, with the police department, and we've gone out and seen someone laying on the floor, whatever, please still come help us. So those kind of things. And you're right, it's a eyes and ears.
Yeah, definitely.
More eyes and ears.
What would you say would be the biggest problem that you or your team solved last year?
Well, I think for several years we've been talking about this area in Wichita County that's unserved. And when COVID came around, it really brought that to light because even though people may be self-sufficient, there was an issue maybe with transportation or maybe just coming into the city, into town. So there's a rural area out there, and so we were able to sit down, put together a strategic plan. We found the funding for it. It just all fell into place. Wow. And so we're going to start that program, and we're excited about it.
That's awesome. What advice would you give to somebody that's pursuing a role similar to the one that you? Red
Bull. Lots of Red Bull.
It gets you going?
Yeah, Red Bull and Starbucks. I would just tell people again, don't always take what you see as first thought. Dig a little deeper, because sometimes we all have a story. Mm-hmm. We all have a story, and sometimes we have to dig a little deeper to get to that story to find out what somebody truly needs to help them. And again, Red Bull, Starbucks, all those things. Yes.
Highly caffeinated.
Yes, for sure.
How do you continue to learn to stay on top of things within your role?
We have multiple learning opportunities through Meals on Wheels America, through Meals on Wheels Texas, and again, my counterparts throughout the state and throughout the nation. They've been grateful or wonderful to help us. And, most of it, too, is just clients. We're just trying to make our clients happy.
Definitely.
So we get a lot of feedback from our clients. But we do have tons of rules and regulations and procedures that we have to follow. And we have numerous learning opportunities through all these organizations.
How would somebody in the community be able to reach out to y'all to get on your services?
Oh, give us a call. Our number is 940-322-6232. And then also we have a link on our website, which is www.thekitchenwf.org. We have a thing you can fill out on our website, a form, and you can go right to that, and it comes right to our office. We'll get you called back and get an assessment.
Are there any type of like prerequisites that the individual needs in order to qualify for this service?
Yes. If you're under 60, you would have to call Texas Health and Human Services. Our program is mainly for those 60 and older.
Okay.
So in order to qualify for local funding and qualify for us to just put you on the program, you must be at least 60.
Okay.
And home delivered meals, we ask that you don't drive.
Okay. Be homebound.
Yes. We'll do it. We'll come out and do an assessment. We have a case manager, and we'll come out and do an assessment. And a lot of times we'll actually put you in touch with other organizations and other needs that the client might have. So we try to do that in the community also.
Oh, awesome.
What's the turnaround time from when somebody puts in an application for the services that they get feedback or get the evaluation?
Well, that depends a little bit. Our goal is to make all that happen within 48 hours. And
That's pretty fast.
Yeah, that's our goal. Is 48 hours.
Excellent.
Because if you're hungry, you're hungry.
Yes.
Uh-huh.
And every moment counts.
Right. It's not going to go away.
Yeah.
So,
What occupation, other than the current one you have, would you consider trying?
I would own a petting zoo.
Oh.
Yes, I would have a petting zoo, and I would have all kinds of little animals, and that's what I would do all day is play with animals.
Do you currently have any animals?
I do. I have some animals, but nothing like a petting zoo. I'm an animal lover, and that's what I like.
Oh, amazing.
Yeah. I wanted originally to be a veterinarian, but I couldn't handle the sick dogs.
Oh,
I just want everything butterflies in my
you just
world.
want to be able to fix everything.
Yes. So it would be something to do with animals.
Oh, amazing. Well, Jackie, is there anything else you would like to share with us before we go?
Oh, I would just encourage people to come out. Let us show you our organization. Volunteer. Lee Grace at our office is our volunteer coordinator. Even if you only want to do it a day, come out and volunteer. I just encourage people to get involved in your community. Get involved.
Definitely. All right, Jackie. Well, I appreciate you joining us today.
Oh, thank you for having us. We love to
course.
talk about the kitchen.
Yes. Well, guys, thank y'all for joining us, and y'all have a good day.
Thank you.
Thank you.